Good afternoon, brothers and sisters at UMass. It's Richard Poole here. I wanted to give you guys a couple of updates on some items that I'm sure you'll find important. To start, I want to say happy housekeeping week and happy Surge Tech week to all the housekeepers and surge techs out there that help the hospital out. A couple of things on that. The housekeepers, without you housekeepers, the hospital would essentially be a breeding ground of pathogens and diseases. And you guys play a vital role in keeping the hospital clean and sanitary and comfortable for the patients and families. So I just want to give a shout out to all the housekeepers out there. Thank you for all your hard work, and it is much appreciated. The surge techs also play a very vital role in the OR. They're essentially the backbone of the OR, and a lot of times the right hand of the surgeon, prepping for surgeries, helping the surgeons out during procedures. Again, without the surge techs, the OR would not be able to operate. So both parties very vital to the hospital, and I want to say thank you to both of you from the UFCW 1445. Now, on to a couple of items I wanted to just briefly talk about. One is I want to mention an arbitration case that we recently won. We grieved a while back a case talking about the holiday. If you call in the day before, the day after a holiday, you essentially do not get paid. It was brought to our attention through the good work of our stewards that people weren't getting paid if they called out the scheduled shift, last scheduled shift before or after a holiday. I'll give you an example. If a holiday is on a Wednesday and their last day on was on a Monday and they called out, they weren't getting paid for the holiday. So that was against our contract, and we immediately filed a grievance when we found out about this. So, of course, the hospital fought us on this tooth and nail, went through all the steps, and we decided to go to arbitration, which is, for those who aren't familiar, is essentially both parties, the hospital and the union, pay money to have a arbitrator, like a judge, come in, listen to both sides. We have a very good lawyer in Al Gordon, who gave an excellent deposition, along with myself and the steward, Brian Lavero. We won. The arbitrator found that the day before and day after stays just like that. The arbitrator even gave a definition from Webster's Dictionary in the report stating that it's 24 hours of rotation. That's what a day is. So this may not seem like big, but it is big, because now the hospital has to go back, and anyone that they didn't pay during the contract have to pay for those days that they called out. So, again, this is why you guys have a union. We fight, and we will continue to fight for cases such as these. The other item I wanted to bring up is the health insurance. So, a lot of you have come to me over the last year about the increase in cost. 22% over the last 2 years. It's a lot of money. You guys have great health insurance, and I think most of you would agree, but at the same time, everything goes up in cost. You guys can't afford it. And we heard, Fernando Lemus, myself, and Jim Ronayne have heard your angst. Every time we went to the quarterly meetings with the hospital, we brought that to the table. And the last meeting they had, we were under the premonition that the costs were going to go up again from Harvard Pilgrim HPI. We absolutely said no. So we put out a bid to Blue Cross Blue Shield. Blue Cross Blue Shield, we've had in the past, has a larger network of doctors, and nothing will change. The system design will stay the same. That includes co-payments, deductibles, and weekly premium. So there will be no change in service for the members. Now, I will say that there is a very small group that could be affected by this doctor-wise. The hospital and the union are working together now to ensure the minimal disruption of coverage. So you will be receiving a letter from the hospital stating this change, along with a phone number that states you can call if there's any concerns. But I wanted the members to hear this firsthand from us, because we are at the forefront fighting to make sure that the health insurance stays the way it is and the coverage stays the same, because it's very important. Last thing I'd like to mention is I want to give a congrats to the Starbucks people at UMass who recently voted to join the union. Well, the hard work has paid off. They have their first collective bargaining agreement with some good, decent raises. They have a nice structure of a contract given successorship. So if Sodexo leaves, they have some protection. So if you happen to be in the university campus, the ACC campus, and you're getting a coffee, congratulate them, because it is a big win. And it was because of a lot of you who supported them during this that they were able to do that. So again, thank you. Our next target, and we're not hiding behind this, is the group over by the stateside. Those Sodexo workers recently were told that the Sodexo group is leaving. They lost the contract. A new group will be coming in, and this is one of the reasons why they should be unionized. This is causing a lot of angst and concerns from the members. So we will be working with our organizing team to try to get them organized. Again, I just wanted to run those items by you. If there's any problems, concerns, please feel free to reach out to me. I'm always available and willing to listen to your problems. One last thing before I sign off, I want to mention, if you have a concern and you bring it to the attention of a steward or myself, and you feel you're being retaliated by your manager, by comments, side snickers saying, it doesn't matter what the union's going to do or anything like that, I need to know about this immediately, because it is wrong. It could be considered an unfair labor practice, and it's unacceptable, and we will not tolerate it. So again, you should always feel comfortable coming forward, and it's protected by federal law. With that being said, have a great weekend, brothers and sisters, and we'll see you soon.